This segment of Delmarva Life is brought to you by Peninsula Home Care.
A new coalition is underway here on Delmarva. It's making sure people who are discharged from the hospital can recover right at their home and avoid going back to the hospital. It's a group effort that involves Peninsula Home Care and others in the community. Delmarva Life's Brian Spiros recently spoke to those involved and explains what it's all about.
Local doctors, a hospital, and a home health company are joining forces with one goal in mind.
It is making sure that we come together as a community to ensure that patients stay out of the hospital.
To do this, Peninsula Home Care teamed up with PRMC and primary care physicians in the area.
How are your blood sugars doing?
Here's what they're looking to do. Make sure patients discharged from the hospital then receive proper care at home. For Peninsula Home Care, it's their job to give patients the guidance and treatment they need to help with their recovery and keep them from going back into the hospital. Nancy Bagwell is the director of Peninsula Home Care's Salisbury branch.
I think it's a different mindset if you think about the way that our society has traditionally done medicine. It's been episode focused. You go in for a surgery or you get a prescription. This is actually looking at it from a different perspective, more preventative.
This comes as Medicare is taking a look at the number of patients across the country who are readmitted to the hospital within 30 days. The focus is on those who've suffered a heart attack, have congestive heart failure, or have had pneumonia.
They're looking at these common diagnoses which nationally have high readmission rates.
Dr. Val Nateson is one primary care physician making sure this new coalition works seamlessly.
Hi, Dr. Nateson.
Hi.
How are you?
I'm good, thank you.
If you specifically look at readmissions to the hospital, it's about 25 to 30% of patients are getting readmitted. And most of them can be prevented.
So why are readmissions so high? Dr. Nateson says one of the reasons is people don't listen to their doctor's instructions. Another, and perhaps the biggest problem, Nateson says, people don't take their medication properly. He says that alone can lead to problems, setbacks, or cause their condition to worsen.
If somebody goes home from the hospital and if they don't follow instructions and they don't take their medications how they're supposed to, then they could easily end up back in the hospital.
When you get to the hospital, you're usually on a specific diet or a routine, and when you're discharged, your environment is very different.
That's why Peninsula Home Care comes in after a hospital stay to make sure patients are taking the proper medications and getting the therapy they need. Then there's the added cost that can come along with another trip back to the hospital.
Financially, it's a huge burden. It could be numerous tests that they have to undergo, days away from their family.
Dr. Nateson says for many, being in the comfort of your own home can help you recover quicker and avoid setbacks.
Nobody wants to be in the hospital. If I get sick, I want to be at my place, home, don't want to be in the hospital. Every person who gets sick wants to quickly take care of it and want to be well soon.
We have this patient who we've just had recently admitted who does not have a primary care physician that we would like for you to see for us.
Peninsula Home Care also sees to it that patients are seen for follow-up appointments.
I can see them, I can work with the home care nurses to make sure that they stay home safe.
Dr. William Robbins is what is called a home care bridge physician. He's able to go to the homes of those who need a follow-up but don't have a primary care doctor.
And if you can do some small steps in partnership with the nurses at home, it's been shown that you may prevent that hospitalization and they'll stay at home.
Under the new coalition, if someone does need home care after a hospital stay, it has to be prescribed by their doctor. The actual program goes into effect October 1st. Nancy Bagwell says since the pilot program was launched in July, they've seen how home care can prevent hospital readmissions. Bagwell says data shows during that month, 12 congestive heart failure patients were sent home. Of those 12, only one had to be readmitted for an unrelated illness.
And Dr. Nateson also says doctors have to make sure that when they send patients home, they must have a clear understanding of their discharge instructions and medications. Oftentimes patients don't, which can land them back in the hospital.